My name is Stephanie Stamas, and I'm a physical therapist here at Beyond Basics Physical Therapy in New York City. Today we're going to be talking about what to do if you're peeing all the time. This is a very common problem. And so what's going on? There's a couple things that could be contributing that you can fix right away. The first thing is how much water you're drinking. Counterintuitively, if you're not drinking enough water, then you're not going to be diluting the food that you're eating. And a lot of the food that we're eating are bladder irritants, meaning they're very acidic, or there's something in them that when they get to the bladder, they're going to irritate the lining of the bladder. And the bladder is going to get upset, start contracting, and try to push it out. That contraction feels like urgency. And so if you are eating foods and you're not drinking enough water, or you're intaking just a lot of bladder irritants in general, that can be something that would lead to going to the bathroom all the time. So if you've already dealt with that and you're still going to the bathroom a lot, then another thing might be just habits, bad bladder habits. And these are things that we can learn when we're very little. So when most of us are little, we learn to go just in case, or we like to call it jicking. And so what happens when we go just in case is that we start messing up with the signals between the bladder and the brain. And so how the bladder works is that it gets to a certain level of fullness, and that certain level of fullness does a stretch on the bladder, and that sends a signal to the brain of, hey, this person has to go. And so when we start messing up with those signals, we start training the brain that at a different level of stretch is when the bladder should send a signal to you to go. And so the bad news is that we can train our bladder to send us signals of urgency even when our bladder is not full. But the good news is if we can train it poorly, then we can train it back very well. So how do we train it? We train it through something called scheduled voiding. And so if you are someone who's going every 30 minutes, which is abnormal, you can slowly start to retrain the bladder and the brain by scheduling your voids every 45 minutes. So normally we should be going to the bathroom about every 6 to 8 times a day, which translates to every 2 to 3 hours. And so going every 30 minutes is definitely not functional. And so if you're going every 30 minutes, 2 to 3 hours sounds impossible, but maybe at every 45 minutes sounds like a better goal for you. And so scheduled voids do just that. They provide more reasonable goals so that you can slowly make your way back to norm instead of trying to go from 0 to 100 right away. So when you start to feel comfortable going every 45 minutes, then you can push it to every 60, then every 75, and slowly you're retraining that connection between the brain and the bladder so that your bladder is not in control of you, but that you are in control of your bladder. Thank you.